Good afternoon, and thank you for joining us today. This is the first Red River COVID-19 Task Force update since May 27th. The recent developments in the battle against the virus, we felt it appropriate to provide an update to our efforts locally. In the past briefings, you've heard directly from our largest healthcare providers, Sanford and Essentia Health. The good news is that hospitalizations and deaths have gone down and remain low in North Dakota. They are not going to be reporting today. As such, this briefing will consist solely of updates relating to the Red River Valley COVID-19 Task Force. I would like to introduce my co-chair, DESI FLEMING, to start us off. DESI?
Thank you, Mayor. Good afternoon. It's been a while since our last briefing, and we thought it would be helpful to come together to talk a little bit about where we're at as a community, what we're doing on a task force front, and talk honestly about what's gone well and what concerns that we have. Our first cases of COVID were reported back in March, nearly 4 months ago, with the establishment of our Red River Valley Task Force in early May. Cass County reached a high of 93 cases on May 20th, and through targeted testing, effective contact tracing, and education and messaging, we managed to decrease our numbers and have maintained a fairly static case count, hospitalization, and death rate. The push for the task force formation was due to our very high positivity rate, which at the time was over 10%, considerably higher than other counties in North Dakota. The task force recognized very early that mass testing was not the solution for our area, so instead chose to prioritize our testing resources for those groups at higher risk of exposure. Our goal of finding positive cases, along with our robust contact tracing effort, eventually drove down our case numbers as well as our positivity rate. As of today, our positivity rate has significantly decreased and is much more aligned with that of the state. We continue to utilize our allotted testing capacity through the North Dakota Department of Health Lab, along with carrying out logistics for all of our testing events. The testing strategy is continually adjusted to meet the emerging needs of our metro area. Over the past month, the task force has been collaborating with the North Dakota Department of Health to consolidate Cass County specific data. Access to this data then helps drive decisions and adjusting strategies and identifying further needs in our area. And Brenton and Dr. Carson will be giving examples of that in this briefing today. The task force strategies also include working with area businesses, community groups, and schools to provide guidance and recommendations. We've developed COVID resources along with some translated materials to help community agencies navigate and adjust services as needed based on current CDC and state guidelines. Being this virus is new and not knowing what it was going to do, many of us were hoping that COVID would act like influenza and disappear over the summer months, and clearly that didn't happen. With the 4th of July weekend and further opening of businesses, restaurants, and bars, as well as people not fully adhering to those prevention practices, we're seeing a slight uptick in our cases locally, as well as greater increases across the state. A concern many of us have as we move towards fall is how to manage and control the current pandemic situation in order to avoid a major collision with influenza season. We know the probability of creating, producing, and distributing a COVID vaccine by influenza season is highly unlikely. If all goes well, current predictions are for early 2021. Until then, we need to rely on prevention strategies to help us navigate those two viruses, along with the regular health needs of our community in order to prepare and try to mitigate any potential surge in illness and hospitalizations that may overwhelm our healthcare system. The best strategies that we have at this time, which have proven effective when followed, are social distancing, hand washing, avoiding crowds, being outdoors, staying home when you're sick, and wearing a face mask in public. Each of these strategies provides a layer of prevention. When combined, it provides yourself and others a higher level of protection from COVID. But that means that we all have to share in the burden of protecting not only ourselves, but others. The reality is that all of us are at risk for contracting this virus, and many of us will. It may not be deadly for some, but it is for others. There's new research by UC Davis's Children's Hospital showing social distancing reduces the risk of transmitting the virus by 90%, and wearing a mask decreases the risk by 65% by creating an effective barrier. The degree to which we embrace as a community those strategies, as well as the others I mentioned, will determine how successful we will be at continuing to slow the spread of COVID. People don't like being told what to do, myself included, so I understand that there is resistance. But you can't argue science, and science has shown that these strategies play an important role in decreasing the spread of COVID. This doesn't necessarily have to mean mandates. What we are asking for is a good, solid effort from everyone to practice these public health prevention measures. If you care about your family and friends, if you care about your community, please do your part. I'll close with a quote from Henry Ford, who stated, "Coming together is a beginning, keeping together is progress, working together is success." And that's what it's going to take. Thank you.
Thank you very much, Desi. Our next speaker is North Dakota Department of Health Regional Field Epidemiologist, Brenton Niesemeyer.
Thank you, Mayor. And today I'm going to talk a little bit about contact tracing efforts and how things have changed, and then the average age of our cases and how that has evolved in the past couple months since May. We've done a really good job in our long-term care facilities in North Dakota and keeping COVID out. We've lowered the number of cases, lowered the number of staff that have been infected, and lowered the number of residents that have been infected dramatically since the start of the pandemic. And honestly, we'd like to keep it that way, since we all know that the people in our long-term care settings are the most vulnerable to severe outcomes of the disease. That being said, our average age has dropped about 10 years, from about 45 to about 35 in Cass County since the beginning part of the pandemic. And you may ask or talk about how these, and here's a graph that shows that average age over time and how that has dropped. You may ask or talk about, well, that's good, the young people have less negative of health outcomes, and that is true, but our younger population is also the population that's working in our healthcare settings, that's working in our long-term care facilities, that may be serving our vulnerable population, whether it's in homeless shelters or group homes or other type of congregate living settings. And it only takes one person to reintroduce it back into those type of facilities, which have done so much work in order to prevent COVID into their facilities. So as young people, as a young person myself, I'd like to just, implore you all to, and everyone in Cass County to continue to practice that social distancing, wearing the mask, hanging out. When you're hanging out with friends, consider hanging out in smaller group settings, since we are more social, we are more mobile, we are more outgoing generally. Hang out with smaller groups of friends, that small core cluster versus inviting 20, 30 friends over at a time, potentially doing, small groups of 5, 6, just so that we have less exposures if someone in that group were to test positive. And that kind of evolves and goes right into my discussion about contact tracing. With a younger population, we are having more difficulties or identifying more contacts when it comes to contact tracing efforts. We are more mobile, we are going out, we are seeing groups of friends, maybe Saturday night and Friday night, maybe Sunday night too. But that just leads to more people that have to be quarantined, more people that you have to remember, more people that we have to contact and follow up on. And I think we said it at the early part of the pandemic, if you can't easily remember or count the number of contacts that you've been within the past couple of days on one hand, or 2 hands now, then is it worth going out and hanging out in those large group settings and potentially having that many of exposures? And just a plug for contact tracing, our contact tracers across the states, both North Dakota, Minnesota, and wherever you are, work tirelessly 12 hours plus a day, 7 days a week to talk to you all and educate you all on the risks and exposures with COVID. So if you do get a call from a contact tracer, please make sure to take it serious, because we are just trying to do our effort and reducing the spread. So when you do get that call, make sure you answer it, make sure you're truthful, and make sure you stay home and don't go out for those 14 days from your past exposure, because if we do it together, we can hammer down COVID and hopefully get less restrictions and continue on with more of a new normal versus what some of you all may seem as a little bit too much restrictions. But do your part now and we can get back to a new normal and quicker and more easily. Thank you.
Thank you, Brenton. Appreciate that. The next speaker is North Dakota State Department of Public Health Professor of Practice, Dr. Paul Carson.
Good afternoon, everyone. It's a pleasure for me to update you a little bit on our data that we've been looking very carefully at as part of the Red River Valley Task Force. We've worked very hard with the state health department to get more granular data on what's happening in Cass County so that we have better information on knowing where to focus our efforts and where to intervene. I'll be sharing some of that data with you here now, and then also talking a little bit about where some of the science is on masking, which has become such a hot button issue. So first off is just looking at our 14-day rolling average of new cases in Cass County versus the state. So the red bars here represent Cass County, the gray bars are the cases outside of Cass County. And what you can see is that through the efforts of everybody kind of pulling together in North Dakota, the cases fell very nicely here kind of in late May, early June. But things are starting to tick up again, much more in the rest of the state, a little bit in Cass County. And this is in part from several different things. Some of this is indeed due to increased testing efforts. We have been ramping up and aggressively doing more testing, but it's clearly not just that. As Brenton just talked about, we're seeing clusters of outbreaks related to increased activities such as 4th of July parties, weddings, funerals, other family gatherings. And we kind of look at this uptake and just take a cautionary note here on let's not let this get any further. And I think one of our success stories is drilling down a bit further on what's happening in long-term care. So this is the cumulative number of active cases being followed in Cass County. And here, the red represents what's happening in long-term care facilities or our nursing homes versus those cases that are identified outside of long-term care or nursing homes. And we've pushed a lot of efforts towards trying to keep this out of our long-term care facilities. We have a huge amount of testing going on a weekly basis of essentially all long-term care staff and workers, and pretty frequently, almost weekly as well, on most residents in long-term care. And you can see that those numbers that are in long-term care have diminished greatly. And that's been a tremendous success story. Again, a cautionary note, we've had a couple of little flares here starting back in Cass County, and we don't want that to happen anymore. And those usually bubble over from, as Brenton alluded to, young workers that are out in the community, and they may pick it up and be asymptomatic and bring that into the facilities. And we do lots and lots of efforts to try and prevent that spread, and the testing has certainly helped. So this, I would say, is overall a success story that we want to maintain. When we look at some of the more objective measures that help us understand where the pandemic is going, we look at hospitalizations and deaths. Those are very objective measures that aren't going to be influenced by where we're testing and who we're testing, and some of the variations in that from week to week. And here we can look at hospitalizations, which is new admissions to the hospital. Red, again, is Cass County. Gray is non-Cass County. And you can see the numbers were falling off in hospital admits, kind of picking back up again, but not so much in Cass County. It's more in the rest of the state at this point. Similarly, we look at ICU admissions. Red again in Cass, gray in outside of Cass County. And you can see that people admitted to the ICU fell off greatly here in late June, early July, a few cases ticking back up. And two relatively recent ones from Cass County, but before that it was mid-June before we had anybody admitted to the ICU, which again we're very, very grateful for and happy about. And then when we look at deaths or mortality, we have had, unfortunately, 3 deaths in the last week in Cass County, 4 deaths in the state. But overall, those numbers were falling and spreading out, and this tends to be a trailing indicator. So Deaths and hospitalizations may fall anywhere from 2 to 4 weeks after you see new cases. So when we see a little uptick in cases, we kind of want to watch what's going to be happening in our hospitalizations and hopefully no deaths, but what follows in the 2 to 4 weeks after increase in cases. So we're going to keep a close eye on that. And then DESI alluded to earlier about percent positivity. This is another indicator that helps us sort of understand where things are at in our community. And we had very high rates of positivity early on. Now that was in part because we were mainly testing people who were presenting sick, and now we're testing lots of other different populations. But we are now much, much closer to the state average, still running a little bit higher in Cass County. And you see that we reached a low here again in late June, early July, and it's starting to tick back up again. Again, a cautionary note, not anywhere near as bad as where we were. And overall, I would say a positive and good news, but a slight cautionary note that we need to be more vigilant and practice these measures to prevent transmission. One of the things that helps us understand that is looking at how much we're moving about, how freely we're going around in society. And a number of websites track mobile GPS data from our cell phones. In the purple here is North Dakota's mobility as looked at by cell phone GPS data versus the United States. And this is where we were at baseline before the pandemic. And you can see North Dakotans decreased their kind of moving out and about with their traveling and so on by about almost 43, 44%. The rest of the US decreased by almost 53, 54%. But you can see North Dakota has steadily moved back up, and we're almost pretty well back to baseline of how much we were moving around before the pandemic. We're not hanging tough at home like we were in the early part of April moving into May. The rest of the U.S. has also started to move more about, but not to the same degree as we are here in North Dakota. Now, this is a surrogate for social distancing. It's not an actually direct measure of people being close to each other. It's a measure of mobility, but it correlates relatively well with social distancing. And just to finish a little bit on masking, Surgeon General made this announcement on the 4th of July that wearing a mask means more freedom. We may think that these seem like imposing strictures on us, but these are the relatively simple measures that allow us to hopefully avoid stricter or more difficult measures that we all desperately want to avoid. And so I want to review just briefly a little bit of the science on why that is. Now, we know that when we talk, sing, cough, sneeze, breathe, we emit a variety of sizes of respiratory droplets. The large and medium ones tend to fall, usually in 4, 5, 6 feet. Tinier ones can stay suspended in the air and travel further and last longer. Distancing will move you away from these ones, but the smaller droplets can accumulate in the air. And so doing other measures when you're indoors with people to try and decrease being exposed to those smaller respiratory droplets are things like masking. A nice simple experiment that was done and is out there on social media and was published was by a microbiologist in Providence, Rhode Island, where he just did a nice experiment showing both the effects of masking and distancing. He stood in front of a table where he had Petri dishes at 2, 4, and 6 feet away from him. First, without a mask, he coughed hard for about 15 seconds. And then he repeated the experiment with different Petri dishes wearing a mask. And you can kind of see what grew on those Petri dishes at 2, 4, and 6 feet without a mask. Now, these aren't viruses, this is bacterial colonies, but it's a very good surrogate for what is being emitted out of our respiratory tract in our mouths when we talk, speak, cough, etc. And he did the same thing with with speaking and singing and showed the exact same thing. And you see all this heavy growth of bacteria at 2 feet, less growth at 4 feet, hardly anything at 6 feet, even without a mask. That's the social distancing. And then nothing at all grew when he wore the mask. It blocked all of those respiratory droplets from landing on those Petri dishes and growing any bacteria. Those are the same droplets carrying that bacteria that carry the virus. So there's every reason to believe that that should help protect us from those as well. And then, although we don't have big trials showing the efficacy of this yet, we have some very good accumulating anecdotal data. One was a recent published study in the Canadian Medical Journal that looked at a gentleman who was from Wuhan. He started to feel some symptoms, flew to Guangzhou, where he was planning to take a flight to Toronto, got on the flight and flew for 15 hours on this plane with 350 other passengers. But he was getting very sick at that time and was coughing throughout his entire flight. And the one caveat here is that he was masked the whole time. During that flight, he was on board with 350 passengers, 25 who were within 6 feet. The next day after landing, his wife started to get sick, and they thought they both needed to get checked. They went to the clinic, and they both tested positive for COVID, which launched contact tracing of all those passengers that flew with him for those 15 hours. And there were no transmissions in the 25 sitting right around him, nor the remaining 325 that were further apart on the plane. These are ideal conditions for transmission, and it didn't happen with this person who was masked the whole time. We have another example of this from Missouri, where they started to open things up, including hairdressers and barbershops, etc. And they found that there was 2 hairdressers, after they opened things up, who were working, starting to have symptoms, kept working for 8 days while they had symptoms. Eventually, one of them got sick enough to go get tested. That led to the other one getting tested. Both were found to be positive. They did contact tracing, identifying 139 of their clients. All of them were masked per Missouri's regulations during that time, both the clients and the hairdressers, no transmissions. This, again, is an ideal setting for transmitting. Very close proximity for, I don't know how long people are at a hairdresser, but it's 20, 30 minutes. This is an ideal setting for transmission. It did not occur with the masking. So that and some other information that you can find on the Cass Public Health's website. If you go to the website and look for the link on the side for the Red River Valley COVID Task Force and click on that, it will take you to a page that looks like this. And if you scroll down the page a little ways, we have a couple of videos that give even more scientific graphic evidence of how masking works and helps prevent the emission of potentially infectious respiratory droplets. So just to reiterate what DESI had mentioned earlier, what can we do to stay open? I mean, we all want to stay open. We all want to stay with our freedoms not impinged. Well, we should do our best to avoid crowded places indoors, if at all possible. If we're planning social functions, keep the groups small and do as much as possible outside. We have very good evidence that outside transmissions are much, much less common because of the rapid dispersal of respiratory droplets, and ultraviolet light from sun actually inactivates the virus fairly quickly. When we are indoors and around other people, wearing a mask and limiting our time. It's time and exposure that leads to the transmission. Maintaining that distance of 6 or more feet, practicing frequent hand washing and the use of alcohol-based hand hygiene products. And then, as Brenton talked about, if you have symptoms, get tested. We want to know. You should find out. And if positive, cooperate with the contact tracers. And if you are contacted as being someone who is exposed, abide by the quarantine and help prevent the spread. I'll turn it back to you, Mayor. Thank you.
Thank you very much, Dr. Carson. That really has some great examples, and interesting I could take a flight and not give it to any of the other passengers. From Clay County Public Health, Kathy McKay. She's going to give the report what's going on the other side of the river.
Thank you. I will give some information from the Minnesota side. So in Clay County, we did have a peak of cases in April and May. But now there are fewer cases that we are following, 631 to date, and there's 563 of those that are no longer in isolation or recovered. We still have 38 deaths. That's been the same number for the last few weeks. The majority of those deaths are from long-term care facilities. And Minnesota as a whole, they also had a peak in May. And so currently right now they have 43,742 cases, 38,170 of those no longer needing isolation. And they have ramped up a little bit of an increase in the last few weeks where their cases have increased. They have about 1,500 deaths so far. There's been a few more deaths just this last week. The hospitalizations in Minnesota are low, so the hospitals are managing to keep up. There's only been 254 hospitalized this week and 106 in ICU, so it seems to be a pretty manageable rate. They're not seeing the uptick at all. Governor Walz announced the statewide capacity for testing to be 20,000 individuals per day, and that testing has increased since the peak in May. So they've completed about 790,500 tests since the start of our COVID. Other efforts to minimize the spread, including identifying organizational hotspots for testing. And thanks to North Dakota and their static sites, Minnesota is able to continue testing those workers in our congregate care settings and others, and they're able to utilize those sites in the Fargo side. We talk about masking, and there's been some previous discussion on masks. In Minnesota, there's a number of cities that have enacted ordinances for masks. It's Minneapolis, St. Paul, Edina, Bloomington, Rochester, Mankato, Duluth, Minnetonka, Winona, Blaine, and Excelsior. Those cities have already enacted masks for businesses and city buildings, regulating that indoor masking required. Governor Walz is still considering whether he will do a executive order requiring statewide for masks in indoor places. Our long-term care, as Brenton had mentioned, it's certainly improved with all the testing and interventions that have happened. The visitor restrictions in Minnesota in long-term care, there was outdoor visits, but window visits only, and now they just increased the visits to be outdoor visits. Again, 6-foot distancing and masking. That's been just the end of June that they started that. Minnesota is also going to allow an essential caregiver for those individuals who were engaged with a resident and committed to providing companionship or assisting with activities of daily living. And we all know it's been a long time for those residents to be isolated, so this is be a real big benefit for their overall health and mental well-being. And facilities can implement that essential caregiver program starting July 25th if they have the policies in place, or actually currently if their policies are in place to allow the essential caregiver. So we're really happy about the ability to really connect with those that have been isolated for so long. Minnesota continues the Stay Safe order, so we're still in phase 3 of the Stay Safe order. That began June 10th and continues. And it's the social distancing, the teleworking. In other settings, there's restrictions. For instance, bars and restaurants are still a 50% maximum capacity, not to exceed 250 people. The fitness centers are 25% capacity, again, not to exceed 250 people. And some other areas that are restricted to the numbers or the percentage of people that can be there. Places of worship, weddings, funerals are still at 50% or a maximum of 250 people within confined areas. And again, it's the 6-foot distancing and the masking that's required in all of those. Governor Walz extended the peacetime emergency order, and that's extended now another 30 days through August 12th. And that just allows them to take swift action to protect the health and well-being of the families, communities, and businesses. And some of that is he can activate the National Guard to assist in relief efforts, preserve the personal protective equipment, and then efforts to provide economic relief and stability to those impacted by the pandemic. So those are some of the things that that extension of the peacetime emergency allows. So all these actions have certainly saved lives and limited the spread, but we still need to work together in our community. We again reiterate, as previous speakers have mentioned, following the public health guidelines, wearing a mask, social distancing, stay home when you're sick, and wash your hands. The standard public health measures that we've been using for a long time, and we really encourage the public to heed those measures. Thank you.
Thank you, Kathy. Today we have a special guest from the state of North Dakota, Chief Operating Officer Tammy Miller. She's been part of the task force all the way through, and she'd like to make some statements from the state. Thank you.
Good afternoon. Thank you, Mayor Mahoney and other members of the Red River Valley COVID-19 Task Force. It's a pleasure to be with you today. On behalf of our governor, I extend gratitude for your intense focus on reducing the spread of COVID-19 in the Red River Valley, and I want to congratulate you on your results. On May 6th, Governor Burgum announced the formation of this task force to prevent and mitigate the spread of COVID-19 in Cass and Clay counties. As you heard from Dr. Carson, at that time, Cass County was posting the highest percentage of positive tests in the state, with an average positive rate of 9.6% for the prior 14 days. At that time, the statewide positivity rate was 2.8%. The task force has had very strong leadership and collaboration from the mayors of Fargo, West Fargo, and Moorhead, from local public health, the North Dakota Department of Health, the Minnesota Health Department, the North Dakota National Guard, and many other stakeholders. And I want to thank DESI FLEMING and Mayor Mahoney for co-chairing this task force. The task force created and executed a very effective plan, a plan that included increased testing, which was much more focused, contact tracing, expanded resources for vulnerable populations, and enhanced awareness in education. As Dr. Carson shared, that 14-day rolling average percent positivity rate for Cass County has come down dramatically, and now it's at 2.54%. Compare that to just 2 months ago at 9.6% when this task force was established. Additionally, at 2.54% for a positivity rate, Cass County is getting close to the state's 14-day rolling average positivity rate of 1.8%. So big congratulations to the task force and the community on your significant progress to prevent and mitigate the spread of COVID-19. At our task force meeting last week, I really encouraged this group to share and celebrate some of the success of the task force, and I'm happy we're doing that today. As we continue to increase testing and report higher positive daily numbers, I often hear concerns that Cass County is a hot spot and Cass County is slowing our restart as a state. But indeed, that is not true. With Cass County's dramatic improvement in the 14-day rolling average positivity rate, now at 2.4%, Cass County is not slowing our state's restart. And as the governor frequently says, we need to focus on the numerator and the denominator, which means we need to evaluate the positive tests in relationship to all of the tests completed in Cass County. And Cass County is making great progress, and we are just about now on par with the state when we calculate the positivity rate. So again, congratulations and thank you for these amazing results. Now switching gears just a little bit, the state is currently at the green level in our North Dakota Restart Plan. So the green is the 4th level in our 5-level plan. The plan includes red, orange, yellow, green, and blue. The green level means there is low risk for COVID-19 exposure or transmission, low case counts are reported in relationship to total tests, public health and private health care can safely diagnose, test, and isolate COVID cases and their contacts. So during this level, schools and businesses can reopen and much of normal life can begin to resume. However, physical distancing measures and limitations on gatherings are still recommended to prevent transmission. And older adults, those with underlying health conditions, and other populations at heightened risk for COVID-19 should continue to limit time in the community. We have been in the green level now since May 29, and actually we expect to be here for a while, given the unknowns as businesses continue to restart and as we restart schools this fall. We are in the green level, but the mission is not over. We expect COVID-19 to be with us for a while, and we know one of our best defenses is increased testing. Testing allows us to find the positives, and when we find them, we can isolate them, we can do contact tracing to identify and quarantine close contacts. We are seeing increases in the number of positive cases we're reporting daily, but we need to keep this in context. We are testing close to 5,000 individuals per day, and our positivity rate for the state has only increased slightly over the last 14 days. We are currently at 1.8%. This is one of the lowest rates in the country. Generally, positivity rates that are at or near 10% are considered a concern. So we are far from that at 1.8%. We have dramatically increased our daily testing, and we only have a slight increase in our positivity rate. We only have 42 individuals hospitalized today because of COVID-19, and we only have 10 positive residents in long-term care. The state is doing very well in its COVID fight, which is allowing us to restart high contact businesses and schools. But as I said earlier, the mission is not over. And as we adjust to life with COVID-19, let's all be North Dakota smart. Let's remain diligent in our COVID-19 etiquette so we can keep businesses open and restart K-12 and higher ed. You've already heard this several times today. Please continue to social distance. And if you don't social distance, please wear a mask. Remember to wash and sanitize your hands frequently. And if you can, take it outside, because being outdoors right now is a wonderful option, especially this time of the year. You may be feeling healthy, you may feel like you're low risk, and you may feel like you don't need to practice good COVID etiquette. But please do. Do it for those you love who may be higher risk and more vulnerable. In closing, I want to again extend gratitude to the Red River Valley COVID-19 Task Force and to the community. Thank you for being North Dakota smart and dramatically reducing the positivity rate in the Red River Valley to prevent and mitigate COVID-19. We are so grateful to all who served on or supported the Red River Valley COVID-19 Task Force. Thank you for your partnership and dedication to protecting public health and saving lives and livelihood. Thank you. Back to you, Mayor Mahoney.
Thank you, Tammy Miller. Very much appreciate what you said today, and want to pass back to the governor. Thanks for his help and support in this. We've been very pleased how the task force has been working and how we have done get the numbers down. Contact tracing really does work. As DESI mentioned today, there's some communities in the United States and in Minnesota that are doing mandatory masking policies. And I just wanted to cover that a little bit. I have some politicians with me in the room as well, and I don't know that any of us have gone to mandatory mask requirements, but we're just going to talk about some of them that have happened. So Duluth, Edina, Minnetonka, and others have instituted a masking policy, so I took the liberty to look at Rochester. So Rochester enacted a policy in which you're supposed to wear face coverings are required when you're in a restaurant or a bar, retail business, public transportation, gyms, fitness centers, and sports facilities, as well as entertainment venues. The enforcement is always the tricky part, because if you're going to enforce, you're going to put our police officers and people in safety going out trying to enforce it. So in Rochester, it's not a criminal offense. Customer noncompliance will result in the patrons being asked to leave. Refusal could result in trespassing. Business noncompliance can result in a forfeit of the city-issued licenses to that business. Now, guidelines are such that businesses and organizations are encouraged to provide masks at little or no cost, and restaurants and bars are encouraged to utilize outdoor seating. I think as Paul Carson talked today about a couple examples of people who wore masks and did not communicate it to somebody else. Because we've done such a great job and kept our numbers low, I think all of us are concerned about school starting this fall, and we truly want our kids to be able to get back into school. So we don't want to see the second wave of infection, and I think we're working very hard at this. We have an opportunity to minimize the wave and save lives. We, the people, as always, take responsibility for our health and the health of the most vulnerable. For some in our community, the decision to wear a mask is truly life and death. Our elderly and immunocompromised population are counting on all of us to keep them safe. As the director of the CDC said, Dr. Robert Redfield recently stated that if the citizens of the United States can all commit to wear masks for the next 4 to 6 weeks, we can, in his words, drive the virus into the ground. So as mayor, I'm asking you, and it's my political colleagues here as well, don't pass it on, put your mask on. This is a request to the community. It's not a mandate. It's a request in which we all think we can do better. And as we saw again with our infectious disease expert, Paul Carson, talks about outside, we're a little bit safer to do what we need to do. But when you're going into confined spaces, it would be best to wear a mask in those spaces. And also it's the amount of time you spend. Now, your haircut may not take an hour, but if you are in a place just longer than a half hour, you should seriously think about wearing a mask in those areas and doing those things. So I just wanted people to know that. Don't pass it on, put your mask on, and let's try to get this disease not to come back as a second wave and be able to go on into the blue wave after the green wave in the state of North Dakota and in Minnesota to get their businesses back. So thank you, everybody, today. We had no room for questions, Ty, I believe, and we just wanted to update everybody where we're at. People, you're doing a great job. We are doing the things we want people to do in our community, and we will continue as a task force to strive to keep the virus numbers down and keep the contact of people catching it down as well. Thank you very much.